People with obesity face lifelong struggles. They struggle with keeping up with their active family's life. They struggle with public perception, and they also struggle with physical pain. Here at Overlake, we have a metabolic and bariatric program that has been around for many, many years.
The one thing I would like patients to know about our program is the passion that we bring to work every day. We are dedicated to helping our patients. We understand their struggles, and we're here really to help them through this journey so that they can reclaim their health and their life.
Once you have bariatric surgery, life changes afterwards. It's a whole new lifestyle. So the staff, the providers, they were always there for me, whether it was a phone call or a message through my chart. Every time I needed them, they were there for me.
So bariatric surgery is indicated if a patient has a body mass index of greater than 35 and a comorbid condition like diabetes, high cholesterol, high blood pressure, sleep apnea, or a body mass index of greater than 40.
What made me a great candidate for weight loss surgery was that I knew it wasn't an easy solution and that I was going to have to do the work after surgery. When I first called Overlake, they invited me to come in and talk with them one-on-one, and I didn't have to jump through a bunch of hoops or go to seminars or see a bunch of videos before actually seeing a person. So that felt very personal to me right from the first call.
At Overlake Hospital, we are one of the highest volume hospitals in the state, and our outcomes are excellent. That's a reflection of not only the surgeon and their years of experience, but also our nursing staff and every other part that goes into having a safe and successful operation.
Overlake has been awarded many accreditations. First and foremost, we are an accredited comprehensive center for bariatric surgery through the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. We also have received several awards from health grades, and we also have achieved several designations with private payers. Many of these accreditations dig into our outcomes data, and that sets us apart. Many of these accreditations were either at the national benchmark or even better than the national benchmark. And so that speaks to the patient to let them know that they're in a safe and high quality center. Bariatric surgery is not like other surgeries. We really have a unique situation where our patients see our providers for life. And so it's important that you have a connection with the surgeon that you've selected.
So patients have different goals that they set from all different areas of life. Sometimes people enjoy exercising, other people have goals like spending more time with their family or loved ones, being able to do things that they weren't able to do before. A lot of people talk about not having to wear a seatbelt extender, being able to fit in a ride, something that they enjoyed doing previously and were limited because of their size. Often those non-measured goals are big and exciting changes that happen. So we try to set realistic ways to reach their goals. For example, if someone has diabetes and they want to get off of their insulin, after surgery they have remarkable improvement, but they also need to continue with their dietary recommendations.
My entire adult life, I've been trying to lose weight. I knew that I needed gastric bypass surgery. I needed something that was going to give me that discipline, that was going to help keep me on track long term. Not just a quick fix, and that was going to, I could end up gaining weight in 3-4 months. I needed something that was going to help me throughout the rest of my life.
So we meet a patient and we start their pre-op process. It's an assessment to make sure that they're safe for surgery. So a medical assessment is part of the evaluation done to make sure that surgery is going to be safe. A psychological evaluation is done to make sure that patients are safe for surgery as well.
Here at Overlake, we primarily perform laparoscopic or robotic Roux-en-Y gastric bypass or sleeve gastrectomy. Those are the two main operations. We also do a lot of revisional surgeries when patients have problems with their prior operations. The gastric bypass is the gold standard because it seems to have very good results over a long period of time, and on balance it seems to have a very good profile of good outcomes and low risk. And then there is the sleeve gastrectomy. That operation is elegant, simpler operation that has also good weight loss results. Patients like the sleeve a lot because when they research it, it seems less complex And so we try to pick between the two, depending on if a person's weight, if they have diabetes or not, if they have heartburn or not. A patient decides on the operation with input from us. They come in, they tell us their story and their medical problems and what their goals are and what their biggest concerns are, what are they looking for. If they say, you know, my goal is to get rid of my diabetes, then maybe we recommend the gastric bypass. If they say my priority is to keep it really simple and the least number of complications, then we might say let's do the sleeve.
Surgery is a big lifestyle change, and there is significant care afterwards that we recommend for our patients in order to achieve the best health and the best outcomes. So for the first year, we do see our patients quite a lot. We see them typically at 2 weeks after surgery, then again at 2 months. And with both of those visits, they see a provider, and then they go to an hour-long dietitian class. At 6 months, we see them again with a repeat visit in a class, and then we get vitamin levels and labs done. And then we see them finally at a year with a class and more labs. And after that, we actually recommend lifelong follow-up every year with vitamin levels.
I do recommend that patients talk to other patients who have had these surgeries, go to our support group, go on our Facebook page, and actually hear how it actually impacts people's lives in a real way.
The one-year post-op appointments are my favorite. Everyone's always really excited about the things they can do with their weight loss.
One-year post-op appointments are a very exciting time. Oftentimes people have met their goals and have new goals that they've established. They're an enjoyable experience for the patients and for us.
And people's high blood pressure goes away, and their sleep apnea goes away, and their diabetes goes away, and it's really fun to actually take it off the record and show them that their problem list went from 15, 20 things to just a couple.
My 1 year post-op felt amazing. I've lost over 100 pounds. I am so happy to be able to be active, to do spin classes, do yoga classes with other people. I love it.
I would say if you're considering weight loss surgery, you should definitely come and see us. We have a very hands-on, team-oriented approach to help you get from start to finish.
Hands down, weight loss surgery was the best decision I have ever made for myself.
If you're watching this video and you're thinking about surgery, then I think that surgery is a very good option. It's a safe option. It has long-term success, and patients are very excited and very happy. They are healthier. They will live longer. They will have less medical problems, have lower risk for cancers and heart disease and stroke. And probably the most important thing is that they will likely have a better quality of life after weight loss surgery.